I've always been drawn to women's health. I sort of thought I would go into OBGYN when I was, even before I went to medical school. And then when I was doing my OBGYN rotation in medical school, I really fell in love with labor and delivery. And that was what ultimately kind of sealed the deal for obstetrics. And then once I got to residency, I realized I really enjoy the complicated nature of maternal-fetal medicine. And the really intense and unique relationship that you get to develop with the patients. And so you really are kind of their everything doctor for their pregnancy, and you coordinate all aspects of their care, and you get to know these women really well. And I think that a lot of these women have had a hard time finding an obstetrical home outside of maternal-fetal medicine. And I like that we offer a place for everyone. And really can be challenged by the care that they need. You know, for me, I want to stay in academics. I love academic medicine. I like working with residents and medical students. I like doing research. And I think the program here is really kind of perfect for that, because you're able to do a lot of teaching. We work with medical students and residents when we're on service. We also have the opportunity to moonlight and work as an attending on labor and delivery, which is really nice because I think it keeps up kind of your labor and delivery and obstetrical skills. But then also allows you some autonomy to be able to like make decisions and practice as a fully trained OBGYN. We have a very high-risk patient population. I'm always amazed at the acuity that we have here. And it's a busy service. We have an incredibly busy ultrasound unit. And so I think the ultrasound training is phenomenal. And we also have a standardized curriculum for ultrasound, which I think is really nice. A lot of programs don't. You kind of learn on the fly, which I think would be challenging. It's a lot to learn, and it's not a whole new skill, but certainly an expansion of a skill that you don't get nearly as much of in residency. And then, there's the research aspect of it, which for people who aren't as interested in research, that time can kind of be spent doing other things. We have a fair amount of elective time. But for me, I'm able to really spend a lot of that time developing these skills. Even just figuring out how to balance clinical care and research, I think is a big part of it, and something that this fellowship allows you to kind of learn throughout that period. I really think the faculty and staff are one of the biggest assets of both the MFM division and then also the department as a whole. I felt just exceptionally well supported here. And I think that one of the big advantages of this program is that it's small. And so what you want as a fellow is easily accommodated, because there aren't these kind of strict criteria and set curriculum that have to be met, because there's only 3 of us. So for example, I have already rearranged my entire schedule twice, and our program director has been amazing about it. I also think that our program director in particular is so helpful and aware of this being a good educational experience for us. And so there have been several times where she asks for feedback, and we'll say, I don't think that this is working super well, or like this rotation is frustrating in these ways. And within her control, she really takes that feedback and makes changes and like really wants this to be the best experience for the fellows. We are looking at patients that have type 2 diabetes in pregnancy. There's new technology that's coming out looking at continuous glucose monitors. Most of that research has been done in type 1 diabetics. And then there's been a little bit kind of expanding that into gestational diabetes, but really no work has been done with type 2 diabetes. We have a really strong diabetes in pregnancy program here. And so we are leveraging that program to randomize patients to either receive a continuous glucose monitor or continuous standard of care testing throughout pregnancy. Right now, we're starting as just a pilot study because there's really no data on it. But we're doing a mixed method study so that we're actually looking at clinical outcomes and diabetes control, but then also patient perspectives on this technology. And How do patients feel about this additional information and new ways of tracking their blood sugar? I love Madison. I could probably go on forever about how much I love Madison. There's a ton going on. It's like, I feel like it's a big city feel mixed with a small town. So you have kind of all of the benefits of big city. So like I have season tickets to the Broadway productions at the Overture Center, and the restaurants are phenomenal and world-class. And there are constantly, pre-COVID, concerts and activities and sporting events, and there's just always some festival going on. And it's just a great place to live. People are friendly. I have 2 little kids, and the school districts are great. I think the other thing I really like is the winters are cold, right? I mean, there's no getting around that you live in Wisconsin, but the world doesn't shut down during the winter. Like, people are still out and about and cross-country skiing and ice skating and hanging out together and getting outside. I feel like I've lived other places where the winter hasn't been as bad, but people just kind of hole up for the winter. And that doesn't happen here, which I really like. For anyone looking to do fellowship, kind of figuring out what you want and what you want out of a program. And I mentioned this earlier, but I think one of the big strengths of this program is how dedicated it is to fellow learning and to the fellow experience. And because it's small, we can be flexible and tailor that approach to what the goals are for that particular fellow. I think my advice for fellows applying would be thoughtful about what you want to get out of fellowship, and then look for programs that allow you to do that. And I think probably regardless of what you want out of fellowship, I think that this program can accommodate that and can help you succeed.